Have you heard that supplements like maca and black cohosh might be herbs that work for perimenopause and menopause, and you're curious about whether or not it's worth trying? Hi, I'm Dr. Patricia Mills, holistic medical doctor with the root cause approach to health, and welcome to the Wild Wisdom Show, where I empower women to transform their health using root cause solutions. And today we're going to be talking about the top herbal supplements for perimenopause and menopause relief that actually work according to research. So, in order for me to share with you what the herbs are that you might want to try for perimenopause and menopausal symptoms, it has to have been studied in research at least once and having had great results. So, let's dive into it. Now, there are different categories of supplements depending on how they work in the body to improve the symptoms of perimenopause and menopause. One category is what's called an adaptogen. So it doesn't actually contain any hormones in and of itself. So it's a herb that doesn't have any estrogen or phyto or progesterone or testosterone like molecules, but has been proven to go into the body and communicate with the brain, for example, and cause the brain to better send signals to other tissues that are producing hormones. So it indirectly helps hormone balance. And adaptogens, by definition, will help you if you need it and don't help you if you don't. And it'll adapt your body to the situation that it needs best. So if it needs a little bit more of this, it helps. And if it needs a little bit less of that, it helps. So it's a wonderful category of herbs that tend to be very gentle and yet very powerful. So we'll be talking about a few of those. The other category are herbs that contain phytoestrogens or progesterone. So they are plant molecules that look like our own estrogen and look like our progesterone in a way that actually improves our hormone health when we take them in. And it helps correct some of those deficiencies that we experience in perimenopause and menopause as our estrogen and progesterone levels start to decline. So we're going to be looking at that. And then the other thing we want to consider is, are we trying to improve symptoms of perimenopause and menopause, like hot flashes, night sweats, sleep, mood, sexual health, those sorts of things? And or are we looking at reducing the long-term effects of having lower estrogen and progesterone, such as osteoporosis, dementia, Alzheimer's, and those sorts of things, right? Because what we do know is that bioidentical hormone replacement therapy is showing significant promise. We definitely know it helps for symptom management, and it's showing significant promise for those reduction of those long-term consequences. So that's where it's really starting to shine for treatment in menopause and perimenopause. But some women either can't take hormone therapies because of a personal history of breast cancer, for example, or they feel very uncomfortable with considering that as an option, or they're looking for alternative non-hormonal therapies because it's not in alignment with the way that they want to age into menopause. Or maybe you're trying to reduce your dose of bioidentical hormone replacement therapy by using alternate strategies to support your body, and then you see if you need to layer on some hormone replacement therapy on top of that. So kind of using them together. Either way, this will be very useful information for you to start to navigate and understand what's available and what's out there. So let's start off with maca. It's a root from the brassica family. So, you get broccoli and cabbage and kale and Brussels sprouts also belong from the same family. And maca is a root that has been grown in the Peruvian Andes. And it's a perfect example of the adaptogen that I was talking about, where it doesn't actually contain anything that looks like estrogen or progesterone, no hormone-like activity directly, but it's been shown in research to go to the brain and stimulate the brain to better communicate with all of the tissues in the body that make hormones. So that might be the ovaries, if you still have your ovaries intact in menopause. That could be other tissues that also make hormones. So whether or not you're taking this with breast cancer or not, the good thing to know about maca is that because it doesn't have any estrogen-like direct activity, there's no concerns taking maca with a history of breast cancer, or even taking it with products like soy that do have estrogenic activity, right? So it's a really great supplement for that reason. And I really like it because there was one study that did a really good job. Again, a randomized controlled trial is what I'm usually looking for in studies, where they take a group of people, they divide them into two randomly, and then they give one group the supplement that we're interested in, and the other group, it's called the placebo. Placebo being a non-active thing that looks like it but isn't actually it. But the women don't know what they're getting, so they're blinded. Again, another really great aspect of a study that we're looking for. And then we look at the results over time. So this is a randomized controlled trial that was done on 168 women in early menopause, and they were given 1,000 milligrams twice a day of organic maca for 3 to 4 months. And they measured actually blood work, including hormones and cholesterol blood testing. If you're listening to this and you want to know the PubMed ID identification number for the study, pop over to YouTube and see this. I have it in the slides in my banners, and you can always look up the results. Okay. So the results were that on blood work, after these 3 to 4 months, there were two study groups. One group did it for 3 months and one group did it for 4 months. They found that everyone on the maca had improved estrogen levels, improved FSH, as in the FSH, the follicle stimulating hormone levels went down, which means that it was enough of an improvement in estrogen that the brain was no longer, trying to stimulate the more production of estrogen by increasing follicle stimulating hormone. So that was really cool to see in the study. There was also improved levels of progesterone. And when it came to the cholesterol panel, cholesterol went down. The bad cholesterol that we don't want to see high, like triglycerides and LDL cholesterol, went down, and the good cholesterol, HDL, went up. And so this is really awesome because we know that women who are going through menopause and in menopause, the lower levels of estrogen tend to cause worsening levels of cholesterol, because estrogen is important for liver function, and the liver is where a lot of the cholesterol is broken down and processed and made. And estrogen is also very anti-inflammatory, and when we have more inflammation, our cholesterol levels go up. So for various reasons, as we go into menopause and beyond, we tend to have problems with our cholesterol, even though you might be eating and exercising the same. So things that support hormone health actually can also support your cholesterol health. And isn't it cool that maca, which has been used in the North American Peruvian area for the support of menopausal symptoms for centuries in those cultural traditions, actually improves things to the point where you see it on blood work. So I just love this. And it's a reminder that women have been using hormone supportive therapy for centuries. It's just been in the form of herbs. And now we have more isolated compounds that we can extract and make it more specific in terms of dosing. That's what the difference in hormone replacement therapy is, so long as you're using bioidentical hormone replacement therapy, because that's where the safety is compared to non-bioidentical. But for people who really want to explore this non-hormonal route, you can get really great impact. And now the other improvement with maca was that there was improved night sweats and hot flashes, sleep got better, mood got better, nervousness, energy improved, and headaches went down. So this was important. However, the key finding is that it takes 2 months for symptoms and blood work to improve. So adaptogens are much more gentle than hormone replacement therapy. Not that hormone replacement therapy is harsh, but it's more direct. You're directly feeding in and topping up the deficiency, whereas the maca and other adaptogens like rhodiola, for example, ashwagandha, they tend to take a couple of months to exert the effect. They're more like feminine energy herbs versus masculine energy hormone replacement therapy, more aggressive versus gentle and slow. So you just have to decide what you prefer. There's no right or wrong, right? What do you want to try? And do you maybe want to try them together? Wouldn't that be interesting? We don't have any research to support the use of them being used together, but also we don't have any research not supporting it. It simply hasn't been studied yet. So, I'm curious about this. Will there be a day where we do both to kind of support, different systems in that way? Additional studies show that one of the active components, which is called macamides in maca, probably have an anti-osteoporosis and anti-Alzheimer's activity. Now, this research is done in what's called in vitro. So they take tissues of bone and tissues of brain and they add the macamides and see what they do, what happens. And it's been studied in animals like rats. So in animal studies and in vitro, this is showing to be extremely promising. And the really cool thing too is that with Maca and breast cancer, there's no increased risk and it might even be protective. So I like Maca, and that's why I started off with it, because it seems to be pretty safe. It does eventually work, even though you have to be, persistent and patient with it to see if it works for you. And when it doesn't just improve, the menopausal symptoms. It could even potentially improve those long-term health outcomes for which many women are reaching out for hormone replacement therapy for. So it's a really great option, and especially in people who are worried about the hormone effects of hormone replacement therapy, because it really doesn't have any direct stimulating effects on, for example, breast cancer. So it's a really great option. I love this tool in the toolbox. Now, some people can't tolerate Maca, so it's good that there's other options. So let's go and explore some of the other options, okay? And what I mean by can't tolerate is that you might get a bit nauseous or gut disruption. And one other thing I want to mention is that sometimes people get worried about the effects of too much of the brassica family on thyroid health. So things like people get worried about it's called goitrogens, so things that go and stimulate the thyroid and maybe overstimulate, cause issues with it. What's cool is that maca, when it's been either cooked or fermented, it doesn't have as many of these compounds. So while raw maca might be something that you find in the stores, you might want to actually stick with what's called gelatinized maca or fermented maca. Definitely it has to be dried. It shouldn't be fresh, because research has shown that when it's processed in this way through drying, gelatinizing or cooking or fermenting, the compounds that you want go up and the compounds that you don't want go down. So staying away from raw maca just for now, while the research is trying to figure out if that's a problem or not for thyroid health. Now, black cohosh is is indigenous to North America, and the indigenous cultures in North America have been using this for centuries for various hormone issues, including menopausal complaints. And it's different from maca in that it's a selective phytoestrogen. So there are molecules in black cohosh that look like our estrogen and act like estrogen in the body, but it's selective in the sense that it will stimulate estrogen where you want it to stimulate. So you want it to work at the brain, you want it to work in the tissues, in the bones, right, to prevent osteoporosis, and in the brain to improve hot flashes and night sweats. But you don't want to stimulate estrogen as strongly in places like the breast or the uterus, where you can then potentially, not definitively, but potentially run into problems with breast cancer and uterine cancer, endometrial cancer. So black cohosh is really neat because it's a selective phytoestrogen. It seems to stimulate where you want it to and not where you don't want it to. So that's what the research is showing. And a dose of 40 milligrams per day is the average dose studied in research, seems to relieve hot flashes and night sweats. There hasn't actually been that many studies done on black cohosh on its own for menopause. There's been a couple more done when it's combined with St. John's wort, which is another herb that's been used for the treatment of mood disorders like depression, with really great efficacy. And together, it's safe and it seems to be better effects for menopause and mood. So if you're having issues with mood and menopause, then combining St. John's wort with black cohosh might be the way to go. However, St. John's wort is a powerful medicinal herb. It can negatively interact with other prescription medications. So with any supplement, but definitely if you're on a prescription medication, you should always let your pharmacist know that you're intending on starting a supplement or more than one, and ask them to run a check on whether or not there's any negative interactions. So they have databases they can use where they can quickly find out for you, oh, you're on this prescription medication, maybe you shouldn't try this particular supplement, right? Particularly when it comes to St. John's wort. Now, the potential for anti-osteoporosis and anti-dementia activity is also there, again, in vitro and animal studies, but very, promising. And in terms of safety, it also has no increased risk of breast cancer. As far as we're aware, it may be protective because of that selective phytoestrogen activity. However, with black cohosh, there's a very small risk of liver injury. So the risk seems to come from using poor quality supplements or supplements that have different quantities from what they're recommending, for example. But the risk is there. It's very small. So if you have any history of liver problems, it's probably not the herbal remedy that you want to start with or that you want to add on. Definitely ask your doctor if you do have any liver issues, but generally speaking, you want to stay away from this if you have a history of liver conditions. Now, the next one is wild yam. Now, a lot of people have heard of wild yam. It's the source of our bioidentical progesterone that is used in hormone replacement therapy. The difference being that the scientists go in and extract the bioidentical progesterone. Isn't it cool that wild yam has progesterone that looks exactly like our progesterone? I mean, it's kind of crazy, fascinating, this world of plants and the interplay with humans. We've co-evolved together, so it really shouldn't be that surprising, but it still is actually to me. So the wild yam has bioidentical progesterone, but it'll probably have less than what we have in the hormone replacement therapy world, which isn't bad, but it's just good to know. That's one difference. And also a difference is that when you take wild yam by mouth, there's different effects than when you put it on the skin. And we're going to be looking at these different effects. And wild yam is found in China and certain places in North America. It has been used traditionally in Chinese medicine. So it's an interesting one to be aware of. And there have been a couple of randomized control trials, like the good quality studies I was talking about, where the cream is actually not effective. So applying the wild yam to the skin, the progesterone does not absorb into the skin. So it doesn't have any effects on blood work or symptoms in terms of, doing that really good quality research. However, there is a study showing that eating 12 milligrams of wild yam, in this case, it was a purple yam extract, twice daily, so 12 milligrams twice daily, improved primarily the psychological symptoms of menopause, like sleep issues and mood issues. It wasn't found to be that great for libido, not as great for hot flashes and night sweats, for example, as something like Maca. But progesterone is predominantly used in hormone therapy, either as an added addition to protect the uterus if you still have it, if you're taking estrogen, but it can also be very effective for improving sleep and mood in some people. So that's interesting that the research did show that. Now, having said that, if you ever start something and it makes things worse, then you want to stop it, because it is possible. For example, some people will take progesterone hormone replacement therapy and they'll actually feel worse. So everybody's unique. There's a different interplay between, medications and genetics, and the same can happen for herbal supplements. So just pay attention to your body and make sure that what you're doing is really supporting it. Now, there have been no studies specifically on the risk of breast cancer with wild yam, probably because it's a progesterone, a source of progesterone, which hasn't, historically been linked to an increased risk of breast cancer. However, bioidentical progesterone has been, but in this case, this is bioidentical. Some research shows that it might increase the risk for kidney injury if you overdo it. So don't use it if you have a history of kidney problems or if you're on drugs that affect the kidneys. The other supplement that we're going to be talking about, the herbal supplement, is called quai. I hope I'm pronouncing this right. I'm sorry if I'm not. And this also belongs to the phytoestrogen world of herbal supplements, and very popular in Chinese medicine, but typically used in combination with other herbs. So not typically used on its own in Chinese medicine. And actually, research shows that when you use it on its own, it's actually not effective. But when you use it in combination, there was a study that looked at, quai with black cohosh, milk thistle, red clover, American ginseng, chase tree berry, and then a phytofemale complex, they called it. This was a proprietary blend, so they don't tell you how much is in it. It's a supplement that has all of these things together. They found that it was quite effective. So, it's interesting. It's not effective on its own. Is it helping the other herbs be more effective? It's really hard to know. So this is something that I'm not going to turn to as my first line of options. And I'm looking at it more as in, being aware of the fact that it has been used in combination in studies and seems to work when used in combination, but we don't know if it actually is helping or not. We know that it's not something, it hasn't been studied in terms of breast cancer safety, so we're not sure what the effects are. It may increase the risk of bleeding, so you don't want to use it with medications that are already increasing your risk of bleeding, like warfarin, for example, that thins your blood. The next one is soy isoflavones. So we know that soy contain phytoestrogens that look like our estrogen as well. And soy is also a selective phytoestrogen. So soy does not go in and activate everything strongly. It's the same thing as a black cohosh. It'll go in and activate certain areas of the body and not others. So actually, there's been so much research showing that soy is safe. It can actually reduce your risk of breast cancer. And it has been used in breast cancer patients with no increased risk of occurrence or worsening of their cancer. So it's a selective phytoestrogen. And there's been one study that showed good effect. Other studies haven't been that great for it as a supplement, but this one study on soy germ isoflavone given 60 milligrams per day for 6 months, in this case, a non-Asian menopausal woman. And what they found was that it significantly was superior to placebo in reducing hot flushes. So in the treatment group, 44% reduction, in the placebo group, 10% reduction. And it improved estrogen levels, it improved LDL, HDL, and no change in FSH, the follicle stimulating hormone. So not quite as dramatic results as the Maca. However, it did help. So the rest of the research is kind of all over the place because there's different doses used and for different periods of time. But this was a study that was found to be positive that I wanted to share with you. And again, safety-wise, it can actually potentially reduce the risk of breast cancer, which is awesome. Now, the next one I want to talk about is a very interesting one I came across called Pueraria mirifica. Sorry, it's a very difficult word to say. It's Pueraria. Mirifica is Mirifica for those of you who are listening. And it's also a phytoestrogen, but this time from Thailand and Malaysia. So it's a root from Thailand and Malaysia. And what's really cool about this herb is that it has strong evidence for the vaginal health and menopause. So, in menopause, as we have declining levels of estrogen in particular, the vaginal tissue gets thinner, gets more dry. You can get more pain with intercourse, more discomfort in that region through the day. And so having things that can help reverse that can be useful. Again, in hormone replacement therapy, there are some local vaginal therapies you can do, like creams or suppositories. However, this was cool because they actually studied Pueraria as a 6% vaginal cream. And they gave it for 12 weeks to women. And they did research on this using ultrasound and such. And they found that it restored the blood flow to the vagina and it reversed the thinning of the tissue. So it helped the vaginal tissues get thicker. So more moist and thicker, right, from the improved blood flow. So that was really amazing, like a pretty strong study there. And another study gave it as an oral dose, so capsules, either 20, 30, or 50 milligrams capsules. They were trying to figure out, was there a difference between the dosing in terms of effects? And in all of the groups, when given for 24 weeks, it also reduced vaginal dryness, vaginal pain with intercourse, and improved vaginal tissue thickness and health. So that was amazing to see. And it may have protective effects on the bone. Again, this is more of in vitro and animal studies results. There have been no long-term studies on the use of herbal supplements for improvement of osteoporosis or reduction of the risk of osteoporosis, as far as I'm aware. But I will continue to keep my eyes peeled for that kind of research. And the safety of it is not well known. However, generally speaking, when you give things very locally in the vagina, it doesn't tend to absorb into the body as well. So it's more of a local effect, so it tends to be much safer. But if you're taking it by mouth, then you just have to pay attention to how you're feeling, how you're doing, and just being aware of it being like a very medicinal thing and just keeping your eye out for any potential problems. Now, the next thing we're going to talk about is red clover, which is also a phytoestrogen, probably selective, although not as well studied as soy, for example. And you find red clover originally in Europe, certain parts of Asia, and certain parts of Africa. And when researched in menopause, it also improved cholesterol, triglycerides, HDL, LDL, and a significant reduction in hot flashes. I love that it also decreased inflammation. So it decreased a marker of inflammation called high sensitivity CRP. So it seemed to reduce inflammation for menopause, which is really, really cool. Sage is another one that is a phytoestrogen. So wild sage or culinary sage, the sage that you would typically cook with, found in the Mediterranean, has many molecules in it, one of which is phytoestrogen, right? So it looks like estrogen. And it's been used historically for menopausal issues, but only recently, the first study, as far as I could find, has been done on it. And it was a once daily tablet of fresh sage leaves for 8 weeks in menopause, in menopausal women who had more than 5 hot flashes per day. So they had, moderate to severe hot flashes. They were frequently getting it. And they found that there was a 64% reduction in intensity and frequency of hot flashes. And the severe hot flashes that interfere with function, all of them are gone, 100% reduction of severe hot flashes. So that was a very strong and positive result. It also improved what they called urogenital and psychological symptoms as well. So, sage has a very promising future in terms of something that we can use to improve our perimenopause and menopause experience. We don't have enough data to know if it has, protective effects on the brain against dementia, Alzheimer's, and osteoporosis. Generally speaking, when something is working at this level from a phytoestrogen effect to relieve symptoms so significantly, it's probable that it's also having estrogenic effects that are positive on the brain and on the bones, but we don't know for sure, right? So we would like to see the research on that to be more conclusive. And because there's only really been one study on it, there's not enough safety data to know if it increases the risk of breast cancer or not. But again, it seems like plants in general seem to have what are called selective phytoestrogens, and they seem to work in harmony with our body through all stages of life and not increasing the risk of breast cancer. That's a very general statement, not specific to sage, but I wouldn't be surprised if sage had the same protective and not increasing effects of breast cancer. Now, there's a bunch of other supplements out there like evening primrose oil and pollen extract and chasteberry or vitex. And right now, there's just not enough research for me to say, like, this is something you should try. The research is inconclusive. Sometimes it works, sometimes it doesn't. So, again, they haven't really been specifically shown to be extremely powerful in the way that these other supplements I've just talked about have. And there's been some studies where they combine different herbs. So, combination therapy, as an example, there was a study on the combination of soy isoflavone. By the way, you may hear of it as a genistein, okay, Genistein. It's a type of soy isoflavone. So, there should be more and more studies coming out on that one. But generally speaking, a soy isoflavone, black cohosh, chasteberry, and evening primrose royal extracts combination for 12 weeks. And they found improvement in hot flushes and sweating, improvement in sleep problems, depressed mood, hot flushes and sweating, sleep problems, depressed mood, and irritability symptoms. They also found a reduction in that HSCRP, the inflammation. Not much changes in hormone levels itself, but generally speaking, definitely improvements overall in people's hormones and decreased inflammation. So that was really great. And again, it's hard to comment on the safety because it's not something that has been extensively studied in terms of, causing or protecting against breast cancer. So the take-home message is that there are many herbal remedies that are safe and effective for menopausal symptoms. They can treat the symptoms and possibly even reduce the chronic conditions, but we need more research in that field to be very conclusive about that. So if you want to, if your concern with perimenopause and menopause is more of the long-term health effects of the dementia, Alzheimer's, osteoporosis, and increased risk of heart attacks and strokes, that is more, the evidence is more, has been more extensively studied in the realm of hormone replacement therapy. And if you do that, you want to go bioidentical. I have done a show on this before, and you'll want to look it up. It's the complete guide to hormone replacement therapy, or all about hormone replacement therapy, is what you want to find. And when it comes to herbal remedies, it may be that it's enough, but we just simply don't know. But what we do know is that you have to try these. And like, if you're going to try these, you have to try them and see if it works for you. Because what could work for one person might not work for the other. It depends on your medical status. It depends on where you're at, how severe your symptoms are. It could depend on genetics. Like, maybe some of these herbal therapies come from different countries. Maybe if you have a certain ancestry, you would do better with a certain herbal therapy, right? Wouldn't that be interesting? But we don't know that. Like, that's just me hypothesizing and kind of thinking about it over time, and what I would like to try. So, for example, when when I go through perimenopause and menopause, I probably will be bringing these on to start to see, how do they work? How do they improve? Like, I'll probably start with Maca because the research is so strong on that, see if I can tolerate it, wait at least 2 months before I see an effect. Maybe I'll try other things like black cohosh over time. Maybe I'll add things on, layer them in, different combinations. But, it's really great to know that these are very powerful herbal remedies that actually do exert an effect, and they seem to be very gentle and safe when it comes to issues like breast cancer. So it's great news for women who are looking for non-hormonal therapy, or therapy in isolation, or in combination. So I hope you found this useful. If you did, please save, share, and subscribe. Sharing is caring, and you never know when someone might benefit from this wild wisdom. And I look forward to seeing you next time. I hope you have a wonderful rest of your day, evening, or night, depending on when you can.